Good catch. We're back. Episode 48. I think it's 48. Yeah, we were just saying why it's important not to forget the basic sciences once you learn those. Because if your child drops a sulfuric acid bomb on your hardwood floor and it starts to smoke and burn through the floor and the towels that you throw on it, you got to remember, what do you put on it? So what do you put on it? You're supposed to put vinegar would be number one. Or it literally says when I read the back of the bottle, things to have on hand. Baking soda, vinegar. There's one other thing. I don't know what it was.
You kids are soft. You lack discipline.
We landed on the moon!
You didn't earn the knowledge for yourselves, so you don't take any responsibility.
It's like we've forgotten who we are. Explorers, pioneers.
I was like, yeah, I understand why now. So yeah, it was my fault. I put the stuff on the stairs to take upstairs to store it away from where little kids could get it. But in that transition time, a small Tasmanian devil by the name of Kit dropped it on the hardwood floor, which will now cost us unforeseen amounts of money, stress, and yeah. So the farm shut down is because we couldn't afford to fix the hole in our floor. Yeah. And there were other little kids over there playing that I probably traumatized for life. So for good reason. Don't know not to use white lightning, which, you know who told me about that the first time ever? Dan O'Quinn.
Really?
He goes, you never seen that stuff in the jug that has to come in the bag and it stays in the bag because it's so like noxious? No, now I know why they keep it in the bag.
I thought he was talking about Bailey.
On to brighter notes. We've got a speed demon in the house. So you got to tell him that 1 mile time trial. What'd you drop on that? When was that? And what'd you do?
That was on Saturday.
Yeah.
And I clocked a 5:36 mile.
Yep.
And
He'll be in.
Without training, I was pretty happy with that. But all thanks to Alex. He was there to run with me.
Non-paid rabbit.
Any other updates outside of that before we give away some of this?
When's your race? When's your race coming up?
Dude, you've asked me this 18 times, and I have no race coming up.
Yeah.
You had one. I've literally never said I had a race. He asked me this.
He's a professional trainer.
Dude, he has asked me this probably at least 3 or 4 times this week.
The pendulum swung. We spend no time together anymore.
I was going to say, and they live together, yeah. So
I did tell you, this is where he gets confused. Okay, I did tell him that I was training for the race of life. And
you can't use
ever since then, he is stuck that I'm racing.
Yeah.
More than those thoughts, and that's a lot.
Ooh, nobody's beating that.
They play the long game. Let me tell you.
That's a daily Roger Bannister moment. Constantly,
they're all trying to seek the first ever sub 4 second thought.
Yeah,
and they don't quite win.
No. All right, let's give some away. So we said, so the podcast was 2 Thursdays ago, and Trent had thrown down the gauntlet of guess how many times we use a rock tape product in the clinics. That would be all clinicians using. We were kind of debating about the guess that was given. There was only one guess, so thanks, guys. But the guess was 26 times over 2 treatment days, and I kind of said I think I agree with that. Between, I don't use floss a ton. I use it sometimes. I saw yours is all unraveled. You just used yours the other day.
I used it 4 times on Friday.
Yeah, that's just on himself. And then they have, I thought it said military grade, medical grade silicone. So they have cups. So we're cupping a lot of people for a variety of reasons. Vibrating cups, which is just separate subset. We have all the stuff back here. Blades. They have a, what's that actually called? What's the description on the top one? What do they call it? I mean, it's a, yeah. But what's the description say? Yeah. So it just is different languages. Monsieur Vibrating to Rockwave Pro. Yeah. Rockwave Pro vibrating massager. It's like 4 different frequencies. It's got some different heads. I use that a lot and kind of mimic Stecco. And then, tape. So that, again, I see some pink argyle up there. Rock Tape was nice enough to send us a bunch of rock floss tape, their new Rheon tape, which is basically when you ballistically load the tape, it doesn't have any give. If you're just loading it slow, it gives just like regular rock tape. Cups, vibrating cups, and the blades. So today, from our one guest from a guest, not a guest, I don't know.
Guesses.
Maloney So you guessed 26 times over 2 treatment days. You're wrong. Actually, we don't know. I think it's more. But you get these are XLs. I don't know.
Oh, yeah, I had that one.
There you go. I didn't know these were bigger. So you get the XLs there, Griffin. And you also get some rock floss. So what I need you to do, and this is also going to prove out if you continue to listen to the show, you have to send me your address where you want these things shipped, and we'll also throw in a farm hat. I fully expect some sort of picture with you with your farm hat on, with cups on your face, with something on your body rock floss. If I don't get that, I'll send you a return label. So, yeah. Anything else? So theme of the day is overhead athlete. All right. And we have sport-wise, we have swimmer, runner, volleyball player, and then a softball player. So we're going to play spin the bottle to see who's going. This is seeming a little weird already. So we got some Pellegrino here. Damn it. Okay. Yeah. Okay. So the theme. Oh boy.
Dude, he's over here. Dude, he's so loud.
Every time I do it.
Yeah, he loves slamming that thing.
Had the espresso, boys.
Golly, man.
Okay, so the theme today is overhead athlete, but what you're going to see, because we all know the injuries that are going on. Only one of these injuries is really around the shoulder. We think, typically shoulder, neck, maybe upper back stuff for overhead athlete. So mine is a 13, 14-year-old softball player. She's played softball since she was 7 or 8 years old. She's a beast. She plays third base and pitches and likes pitching, but plays more third base. So she would rather pitch more. She's doing the typical thing that kids are doing now. So she does, travel ball. She's doing school ball. She's also doing pitching and hitting lessons. And her week, and then training, like strength conditioning stuff. So her week looks like a professional athlete. We'll leave that for a different podcast. It's a bit much. And well, I guess it does. That is important to her case. I think the entire reason what she came in for, which was low back pain, the reason it started was she was doing too much. I don't think it's necessarily all of what I'm going to talk about on the mechanics of her throwing. I think that definitely plays into how we're going to back her out of the pain scenario she's in. But she came in doing everything I said, like within any given week, and it also added school ball and games and stuff back in the prior or 3 weeks prior to seeing me. So I don't think I need to go through like, what her top tier FMA is and things like that. If I'm being honest, like she moves pretty well. When we went through the first day, like, bending forward to touch her toes, bending backwards, rotation to the left, like everything hurt her low back. So a lot of things hurt. Jumping on one leg, jumping on 2 legs, heel slams, all these things. You're like, ooh, does she have some sort of pars injury or, facet driven pain? Yeah, she did. So we go about, typical treatment using, another shameless plug, cupping. And I think I needled like multifidus or something like that. We do some dead bug things. We get her moving and she gets up off the table. I think it was 90% resolution of pain. Right. And she's coming in saying like, I don't think I could pitch tonight, nor do I think you should. But then she literally, when she felt that much better, she's like, could I? I was like, we literally just talked about how much stuff you're doing. Maybe we'll just take tonight off, ease back into it. So, I thought this was going to be, hey, she's going to get out of pain. She'll basically attenuate to how much stuff she's doing and she'll be right on her way. Next visit she comes in, she's probably about the same. And it was down to only left rotation was creating pain. So I don't know who was with me. We started working like some hip stability with rotation. If we got her to basically create a good hip hinge and go through rotation, no pain. If she's just standing, she'd dump right back into her back. So you could kind of, the writing's on the wall. You don't access your hip. Awesome. Or you have a preference, what you'd rather choose, which will be like an extension based pattern in your back, drives pain. I go, hey, that's my job. Like if you're going to jump from your right leg to your left leg to throw a softball, you've got to, preferentially load your hip rather than just like slam your back into extension, just rock the ball. So she comes to the next visit worse. Or no, her mom actually calls and she says, hey, she's complaining of back pain like outside of practice to the point where, it's really bothering her. She's not a complainer. So I go, hey, we need to go ahead and get an x-ray, right? Just rule out pars injury, which I didn't think there'd be anything, but it's a kid. So what's our 2 rules in here? Like kids and pro athletes, like we pull imaging earlier. So we pull an image, it's clean as a whistle, which is good. I see her 2 days after mom had called and it already calmed down quite a bit. Why? She wouldn't do anything. So she shut it down. She's like, yeah, I'm like, it's a 1 out of 10 again. I'm like, okay, well, there's what we thought in terms of how you got here. Now we've got to start figuring out, is it just too much or is it how you're doing stuff? So I started looking at softball pitching mechanics, which is not, if I'm going to be honest, that's not my forte. I'm lucky enough to know Brett Winchester, who Brett is probably one of the best in terms of like rehab and treatment and biomechanics, not just the biomechanics of softball pitching. He's worked with some of the best in the world. Still works with a bunch of SEC teams in that respect, but know enough to know that I don't care if you're hopping, you're trying to, crow hop into it, slide, whatever, that how you, like we said, transfer force from the ground eventually to the ball is going to determine, how you do that, where you try to get force, which is just like golf or hitting baseball. And what we could see is, and her dad was in here and he goes, yeah, she does this big, like jump into extension motion. And then they want her to like get really far in her stride, like jump further. It's like, oh, well, show me what that looks like. And once you do that, it would hurt. And remember, like pogo jumps and jumping hurts, so impact. I was like, I think you're just getting too far out in front of yourself, and you can't get into your hip, and you're literally just falling. And then it's probably all arm. So we went through a bunch of different assessments. Like Troy was helping me the other day. Like if we just had her kind of rotate to the right and kind of be in a hip hinge, and then chuck the ball at Troy as hard as she could, how would she do that? I mean, just all arms, right? She wouldn't stand up out of her hip at all, where she, like if you're going to do a power clean, right, or a hang clean in particular. And we even, like, I put her in the position to like have to do that, and she still just all arm or all back. And you're like, it's kind of interesting, right? Like I literally coach her, I'd just be like, okay, all your weight on your left leg, hinge your left hip, and like let the ball rip. And she just like completely stay in her hip and just, like this, rather than like standing up out of that or driving force. So we started coaching her up on that, and pretty soon, two things that came of that assessment style, which led way further away from clinical and more into like that top tier of the function pyramid of like skill, is she just would much rather arm the ball. So I think she's done that forever. I think that's how she learned to do it, even though she's done pitching lessons. And one other interesting thing, that first visit, her mom had an Instagram post that her pitching coach had put up side by side with a pro and then her. The pro, if you looked at her lead hip, so left hip for a right-handed pitcher, you never see that hip deviate in the side-to-side or coronal plane at all. It just drives towards target. On hers, as soon as her foot landed, she would go bump her hip left. And then it's all moving around her low back, which is just like early extension of golfer, right? Like bump your hip out and then just fall onto the right leg. So I go, okay, that's what we were talking about, right? I go, what's your coach want you to do for that? And it was like push harder off your back leg and all these things. I was like, I don't know. I'm not a pitching coach, but whatever. So I go, what feels the best to you? Just show me a good pitch. I mean, it was like a foot less of basically jump, right, or stride. I go, why can't you do that? She goes, well, because they want me to do it longer. I go, have you like tested your like velocity or like spin rate when you just do that little like powerful jump, which she actually came out of her hip? She goes, I don't know. I go, would you get in trouble if you did that? She goes, I don't know. They really want me to do it that way. I go, I bet you throw it. I know you'd throw it more accurate for sure because it's shorter motion, it's more compact, but I bet it's the same. I think it's all arm versus body. And then eventually that one would trump. And I didn't even ask her. I should. I said, John Rahm has one of the shortest swings, I guess in the Live Tour now, not PGA, and also has some of the higher swing speeds and distances out there. And she goes, oh, I love John Rahm, which I should be like, what do you? 14-year-old girl loves John Rahm. I didn't ask, but she knew, so it kind of hit home of like, you don't have to have a giant wind up or a giant stride or a giant push to create power. It's how efficient you are in that movement. So we worked obviously central stability stuff. Again, she didn't have big mobility issues working here, and then it was mainly trigger points around her, left low back that were driving most of her pain. The toughest thing in the world with her, and that's where I want to hear on your guys' cases too, is now I'm competing with a amount of stuff, which is tough because if I don't do stuff, me hitting 500 golf balls, not doing it perfect on my back, pay the price, right? Mm-hmm. It's not that I hit 500 perfect shots and my back's just weak or something. It's like, no, you got a problem there in your swing. Well, now I'm competing with a lot and it's probably not perfect, but then it's very hard for me to create a change in a skill specific thing because I'm not the coach. I'm not at the field. You also have a skill specific coach that she's working with and has worked with for 5-6 years, right? That she has trust in. And I was like, I keep having this idea of, if she came to me as like a Greg Rose is absolutely changing your swing to get you out of pain. It's not just, hey, we're going to do mobility stuff and exercise. It's like, you can't keep doing this thing. That's her. And I'm having a very hard time because like, I can't say, shorten your stride, do it this way, or hey, tell your coach. I mean, that's not going to work out. So that's, I mean, I explained that to her mom. She was actually supposed to come in today, but they had to reschedule for tomorrow or Monday. So yeah, it's just a tough scenario at that point. But like, I know unequivocally that's what's causing it now. And now I have a decision to make of, do I try to talk to that coach? And, you know, is that going to be an ego battle, or, you know, how do I get that message across? But I think, you know, in the golf world, mainly because of somebody like Greg Rose, we've painted a picture of a team, right? That you have a medical person, a fitness person, and a skill person. That's every sport has that at the pro level, more or less, right? Baseball is probably the most, I don't know, old school is not the right word, but like where they feel like, no, the way we do it is the way we do it. It's not very, oh, this is your baseball swing, this is how you pitch. It's like, it's very archaic. But that's changing too. But I think we need more of that, in particular in youth sports, realizing like, I get you got a skill person, but if the medical person's like, hey, this is not the best way for them to do it, that it shouldn't be like, well, this is the way we do it, or the way she needs to do it. Because I would assume somebody that's working with a bunch of youth athletes at that level is not having a movement assessment. If they are, good for them, but also why are they getting coached like that? So I'd like to open that door with that person. I don't know how to do that, if I'm being honest, because I think that'd be tough. Yeah, what are your guys' thoughts on, I mean, the case is it's not the most exciting one in the world. Like, we can do minimal stuff, get her out of pain really fast in office. So you're like, okay, this is not an injury per se. It's a compensation. Then, like I said, I don't think there's like glaringly obvious like functional things, other than like, I would want to manage her hip in a strength conditioning scenario, right? In terms of like, hey, how you load your hip, what are you doing with it? You choose that, you know, movement pattern when we're doing things that are explosive, like jumping, cleans, stuff like that. Outside of that, like, any thoughts on the transition from like clinic to coaching or clinic to skill? And again, I'd like to hear how it correlates with your guys' athletes too.
You said that she is doing some strength and conditioning with their
Yeah,
teams.
I think it's with the team or through the school.
And then it sounded like you at least tested something similar that she might do when she was throwing the ball. Did you test some of the things that she's doing in her strength and conditioning routine?
Not necessarily. I mean, so the other thing is, nothing would hurt her in strength conditioning.
Okay.
Yeah.
That's what I was curious, if they were doing any sort of lunging that she doesn't get, or she gets.
Yeah, she would literally say, nope, I'm fine at strength conditioning. It would literally be play. And the one time when she was really flared up, her mom said that's why she didn't call it. She goes, she was even having pain grounding balls like at third base. And I was like, well, yeah, like, it makes sense. Your back's hurting. Like, it's going to hurt. So I don't think it's like how you're doing that. It's just like flared up. But yeah, all other things weren't painful, which that's why I really siloed into like, oh, it's when you pitch, right? Yeah.
I don't know. I feel like at least the kid that I'm going to talk about for running, his dad is his coach. So he's there for some of the visits. The swimming aspect of it, I told him, because I remember having one of my first patients, she was a college swimmer, and she had brought me a video of her swimming. I remember that, yeah. And I was like, I don't know a ton about swimming. I could see a difference from what was happening with her arm underneath the water. Obviously, you can't get, unless it was an underwater camera, for it to be perfect angle. So like for him, before we get into his case, when he's pulling, his shoulder comes way up into his ear and he kind of over recruits pec and pulls forward like that. And I said, if you want to explain that to your coach, like that's what I see you doing, maybe he has a cue that would be different for you to do whenever we had done some, like a dry land cable pull that I had seen before, where you basically stay in a hip hinge and pull from a cable. Like he's acting like he's pulling. It's not the same, obviously, because recreating water tension versus the band is not. So I said, I don't have a way of telling you should do that when you swim, other than chat with your coach about it and see if he maybe knows, or because he's probably seen people do that.
Well, I guess that's my frustration here is, when her dad was with her on the second visit, I mean, he was saying, oh yeah, like she for sure does this like giant, like extend. And then like, she never recovers. She never gets back into her hip, right? It just stays an extension. And that's why I was like, well, what are they working on?
Yeah.
And that's the cues that we're working on it. A, weren't changing anything. B, I was like, oh, okay. So that's where I was like, how do you step in then and be like, oh, what you're doing isn't working. Here's my idea. And then they're like, well, how's that going to correlate to pitching? That's where I'm like, I don't know. And that's why I told him, like, I don't know how this is going to affect velocity and spin rate. And it's her big thing is her ability to move the ball. That's why I said, like, I would want to be it's like a, ping pong player. I want to be in an ideal position if I want to put a lot of spin and like English on a ball. Cause if I'm like out of position, you're just like recovering, and that's like her pitching. So if my job is like more spin, in particular outside to in for a softball pitcher, you can't be out of position. Otherwise, you're going to start. That's why I told her, I don't want to see shoulder and elbow problems because it's just all of this.
So her coach recognizes that she overextends?
Yeah. And then that's her pain thing. And then she put her coach wanted to put the post up showing the hip difference. Yeah. And I'm like, well, what are we doing for all that?
Because I feel like if you were able to say, we both agree on the fact that her back hurts because she overextends, and the way that we see her not do that here in the office is if she keeps her.
And I want to be clear, I have not reached out to her coach, so I don't want people, say somebody's listening that knows this person or whatever, like I haven't reached out because I need this follow up to be like, hey, how we done? Because we just said she had a 4 or 5 day like weekend break. And that's why I said, like, I want her to pitch better, but let's say we can just get her built back up and she can tolerate it. I don't think that's the best scenario in the world, but like, as long as she knows what the issue is and like works on that. And that's why I was just like, and I told the mom, like, if the coach wants to call me, you can tell her what's going on, all that stuff. Like, I think I'd be more passive until I saw that every time she goes and pitches or goes pitching lesson, she walks out hurting. And then I'd be like, whoa, like, let's get a hold of that. Yeah. It's just tough. Much easier in the golf world. And maybe that's just my mindset. Maybe that's my own bias. Like, if I had a kid that was being coached by a golf coach that I didn't know, right? It's easy with the ones we know. Somebody I didn't know, and then I was like, hey, I see this from the movement thing that's affecting your swing. I'd have no problem calling them at all or emailing them or something, being like, hey, I found this. And maybe that's just because I'm like certified or something, and I feel like I can dip my toe in that world. Yeah, I don't know.
Blackjack Education. That's my little pet project with Dr. Audra Lance out of Nashville, Tennessee. And we have 2 great courses coming up for you in 2026. So we're kicking off the new year right with DNS Golf right here in Birmingham, Alabama. 2 days at the farm, 1 day at Greystone Country Club. And we have Greg Rose coming in from TPI. We have Mark Blackburn, one of the best coaches in the world. We have Brett Winchester, the legend himself, and little old me will be helping teach a little bit as well. So you can go, again, blackjackeducation.com to check that out. Also, the last weekend in January 30th through February 1st, we have Dr. Richard Olm coming to Nashville, Tennessee for DNSB. So if you're looking to up your DNS game in 2026, the best bet in clinical education, blackjackeducation.com.
Yeah, golf coach is easier to...
That's what I'm saying. I think we built that mindset because of TPI. There's baseball stuff. I think there's a softball thing too, but it's not as well known, in terms of like that team approach. But like I said, in my opinion, I more than I do. Baseball and softball are more, again, like stuck in a rut in terms of like, this is the way we do it. Tends to be. Right. I mean, Mark Blackburn, golf coach, of the year again, is like, there's a million swings. We got to find the one for you. That's like a lot of sports now. Football, how you throw football. I just watched the new season. I think we were talking about of Hard Knocks, and they have the Biomechanics out there. He's talking about all the different quarterbacks and how they all throw different, and like what, Josh Allen does different and how they're maximizing on that. And yeah, cool. So it even, plays there. It's not just, I remember when I was in high school, my coach was like, no, we're going to throw this way. And that created a ton of problems for me. Versus like, why didn't you just like try to figure out why I could throw the ball good to begin with rather than throw it like you, and then my elbow starts flaring up and can't throw the ball at all, which basically kept me out of the NFL as a quarterback, if I'm being honest. Yeah.
I think some of that as well is in the pitching world, everybody wants to try and maximize that whole like anterior sling to get as much whip as possible. And it's kind of like it's not the same analogy, but it's like a rubber band. Eventually, like the longer you pull on a rubber band, the farther you pull it, eventually it snaps, right? Eventually something has to give. And I think there's like certain people, like you mentioned, have like a certain pitching mechanic that's going to feel comfortable to them. And she picked like, she's been throwing thousands of pitches in that new way that she's been taught how to do it. And then you're like, show me what would be comfortable to you. And she like immediately can flip a switch. And it's like,
she doesn't get into extension at all because she never and I was like,
it's like, how can we not capitalize on that? And it's like, she's 14. So, I mean, she's like just kind of getting through like the end of like puberty almost. And it's like, Like,
Which is the other
she's
part
gotta
of
learn.
which I didn't mention. I think that's part of why she's hurting, like growth spurt and hormonal changes. Yeah, for sure.
It's like she's got to learn, like, one, what her body feels like again. Two, it's like, well, she's 14, so she's still got like 4 or 5 more years before she even hits like college. So, I mean, she's got 4 years of high school that she can still work on velocity.
Yep.
It's like, let's work on like the good mechanics, and then let some of the gym work, excuse me, some of the gym work and other stuff like that start helping with some of the velocity. Because, I mean, they just have I feel like when they go through puberty, they just have like a smaller like engine to be able to like build stuff off of. Until later on, it's like, why are we trying to like open up this huge range of motion when she just went through a huge growth spurt on top of just like the flexibility that they already have, and then it's like they can't control it.
Well, in my opinion, like we showed her, Jenny Finch, huge stride when pitching, but like she recovers in like a hip hinge. Like she's literally just like, 35 degrees knee flexion, hip hinge, and just throws like Nolan Ryan, right? It's just her body's like stacked. I was like, yeah, she has a huge stride, but she like gets into a great like controlled position. And that's why I told her, I go, maybe you can work backwards. Like you're shorter now because, like you said, you lack control. Is you learn like, ooh, that is powerful. Like you might be able to jump further, and you know how to load your leg, and now you can just like add room until you start seeing it break down again. That could be over years. Like, oh, like you look back at film from sophomore year, like, oh my God, look how short it was. But like your position you pitch from never changed once you got like stacked rather than pitching from extension and, whipping your arm around you. So yeah,
that was the other thing is like, start with something that you're like, I feel my hip like load when I like land, right? Like I don't want you to think about this in the games. Like I want you like, this is like where her skill positioning or her skills coach, like whenever she goes to like those private lessons, that's where she gets to work on this. So it's like, find a position where you feel your hip, like when you load into it, and then like, okay, I know I lost velocity. I didn't stride out very far. So now I can start increasing that. And it's like, I still feel really strong when I get out here. Velocity is maybe about the same as it was before, and I don't have any pain. But why don't we just like dial in there? And then you use the gym, in my opinion, of like some of the sled pushes. Like you start learning how to like hip drive through it, and like now you can see what that feels like to then push off the rubber, because it's the same motion. Like baseball, you're pushing sideways. Softball, you get to push kind of straight forward. So it's a little bit different. But
and then, I mean, if we didn't do an arm circle, you can also use I would use heavy, like I'm saying heavy, not like 30 pounds, but like heavy med balls. So it's like, if you're going to throw that thing, you're not going to do it with your arm. It's like, just have them throw from like a 6 o'clock position to or I guess 9 o'clock to like 6, and just be like, what would you do if I had to get that across the room? That's what we were trying to do in here.
That's what I'll do with some of my, not to cut you off, but that's what I'll do with some of my softball pitchers is if they have back pain, like they're getting in a half kneeling position and they have to throw it to me with their hip.
Yeah.
Like if they use their arm, doesn't count. Like I don't care if we're doing 7 reps. If we're 50 reps in and you haven't given your hip yet, like sucks. Like hate that for you.
But the thing that, and I mean, we could talk about, like you had sent me a text this morning about like gait stuff. Like then it also gets into like, you can show us that you can do stuff different here. And like, you'll do it the exact same way when you go out and play. And that's like really tough, because that's a lot of practice. I mean, golf, I mean, you'll literally do it perfect on the range, and you go out and like hit a shot and you go right back to the old way, because you're trying to perform rather than practice. And that's what's hard for people to understand. They're like, I was having pain until I played this tournament this weekend. It's like, yeah, you probably think you're doing it the way we practice, and you're not still. That's time. So that can be frustrating for people too.
The other part too for your girl as well is she's probably thinking about it a ton while she's in the game.
Well, and that's what I tell everybody, like, hey, we're just doing this drill for warm up. You may have to go in between innings and do some stuff to like get your hip kind of like feeling it. I mean, this is what you're looking for, is feedback loops. That's why I was like, you cannot think about this during the game. Now she probably is.
I'm talking about like from like her coach.
Oh,
if it's not, because like you said, like what would be comfortable to you, and she immediately does like pulls out a new stride. It's kind of like, well, in the game, maybe every pitch she's having to think about, which I got to push off in order to throw, instead of just like locate the
velocity drop just with that thought. Yeah, that's a good point.
Like locate the ball, like locate, like where did your catcher set up, and then that's your spot to hit.
That's a good point. Yeah.
So now she's doing like reps on reps of, I got to think about long stride every time.
Yeah, that's a good point. Yeah. We'll see. I mean, again, maybe they change stuff. Maybe they talk to her pitching coach. She's like, oh, yeah, just pitch like that for a while. I don't know. So I'll get feedback on that next time when I talk to her. All right. Let's have you go next, since you were talking about your case a little bit.
Yeah, so this 16, 17-year-old swimmer primarily. He's also running cross-country right now. Back in April, he started having anterior shoulder pain. They were going to his pec. He had seen an ortho previously. They had diagnosed it as a pec tendon injury. And he took some time off. Then he got back to swimming. That whole time, he wasn't doing any weight training. for his upper body at all. And then swimming was still bothering him. So he came in, and this was sometime this summer. I was working primarily on shoulder stability from a sideline and then a quadruped position. And he had gotten back to doing some swimming, no more than like 800 meters, which is pretty light compared to what he was used to doing. Basically just their warm up and then a few drills. Then he started at the same time getting into running for the fall. And we hit a little plateau where he starts to swim about 800 meters in, starts to get that pain in his shoulder. And then he started also noticing it when he was running. So I had seen him a few visits. We could change pain in office, and some of the audits functionally that I was paying attention to were shoulder internal rotation on the right side, pec major trigger point. And again, I had needled some of those, done some side lying and quadruped positions, and those things would change. They would come back. And then I had chatted with Beau about it. He had come in, palpated as well, and been like, yeah, he's got some stuff going on with his with CT junction. And in addition to that, prior, at like a minor audit I was paying attention to was just lat tone on that side. And when we were working along that side there, the long thoracic nerve was actually tender to touch. And so in line with the CT junction stuff, when we adjusted there, mobilized it, all of that stuff, all of those audits started improving. Essentially, it was still, he needed to be able to stabilize his shoulder better, but the restriction there in his CT junction was contributing to some of those nerve pains that he was having. And long story short, we just regressed what he was doing because he wasn't able to do it properly. His shoulder would wing off of the rib cage in not even a lift off position from sideline. Tried looking at that from top down, eccentrically lowering, I should say, and it was still really hard for him to do. So as of late, I had sent him home with just an isometric where he's pushing up against the wall, kind of like a 5-month sideline, trying to feel activation in the posterior capsule. And then the last visit, an MDT right lateral flexion and extension at CT junction. His swimming has gotten a lot better to where he can swim for longer. He swam like an hour practice, didn't have any issue. All of that was easy swimming. The next practice, he did some faster intervals. And halfway through those intervals, he started to feel the pain in his pec again, which we talked about how his ability to basically when you watch him do that sideline drill or anything where we're asking him to use his arm, his shoulder will elevate and then it'll protract where he gets a lot of contraction of that pec. And I haven't seen a video of him swim. I would imagine he does the same thing when he's swimming. I tried to replicate that with that cable pull we were talking about. And I just told him, the more tired you get and the higher the intensity, the less likely you're able to hold the position that you're working on. But he's able to do more before that happens. So that's progress. He also, in the last race that he ran, he's not really having any issues with the shoulder when he's running now. The last visit he was here, still limited shoulder internal rotation, pec trigger point still there. He's come back in today, so we'll see how he's doing with swimming. He ran last week and I don't think he had any issues at that race.
So what did you mention the MRI? Like that he came because he had that before he started seeing you or along the way?
I didn't order one. I thought he had an MRI. I don't have it written on the note, so I don't completely know if he did or not. But he had been seeing an ortho for he had seen him and then done like a 4 or 6 week follow up. I thought they had ordered imaging, but I didn't write it down.
Yeah. Okay. I was under the understanding they told him he had pec tendon stuff off the MRI.
Yeah. I thought I remembered that. Again, I thought I wrote that down.
Yeah. So in his scenario, so skill, it's going to bleed into skill, but like more foundationally, like how he's doing stuff. So like whatever we say, strategy, motor control. Do you think with all of our, I mean, all our people we're talking about, so if we were like DNS purists and we're talking about, okay, how your shoulder blade is on your rib cage, obviously how your hip operates around, you know, your torso, like how much are we either missing or, you know, could we actually make it easier if we really like just focus on central stabilizing strategy? It's like my girl, I'm going to be honest, like that's the first thing we started looking at. I was like, this is actually pretty good. That's where I was like, I think it's like almost a rule out of like, oh, you can do everything pretty well. But then my thing is why, and I'm just like throwing out an idea, why would you not preferentially load your hip to create power? Right? It seems like, well, not a weakness thing, but like, well, it's how you use something, right? Or learn behavior. Maybe she got coached into that from 7 years old or 8 years old, right? I don't know. In his scenario, it's like, why did he start using his shoulder like that? You know, is it, you know, range motion thing from early age, which could still have started as a stability motor control thing? Or do you think it's, you know, just his shoulder? Like maybe he had an injury and he started doing it different at some point. Like anything with his case, so you're like, ooh, yeah, like there's other things that he doesn't do awesome around like central stabilizing strategy. Because his left side, I mean, swimmer, no issues on that side, which again, we can have a dominant like breathing side and stroke length and stuff. Anything else that you kind of thrown
So
out
I don't
there?
know how to answer it when, you know, don't know when or if he started swimming differently or if he was coached that way. Or,
yeah, same thing with mine. Yeah, I don't know, but like anything else stick out with him? You're like, yeah, he's pretty solid, like on other stuff. Because like with mine, I was like, oh, you're pretty good. Some people you're like, oh, there's a ton of stuff to work on.
Yeah.
Right. And you're like, oh, it's not even perfect, and I have been working on it. Yet I'm still gonna go from like, you know, it's always a marriage of the two. I get that, but like I'm gonna move from central stuff to, you know, scapulothoracic specific or hip, you know, lumbopelvic girdle, whatever. Does that make sense? What I'm asking, like. Mine, I'm not saying she's perfect by any means, but I was like, you're pretty good for a 13-year-old, you know, athlete that's with your growth spurt and doing way too much in your life. Versus some people are a train wreck and you're like, whew, if I want to keep them swimming or running, I have to make a decision at some point of like where I put all my effort. Right. Yeah. I was just curious if you're like, he's pretty good overall, or there's a lot to work on and we like chose that, or.
Yeah, I don't think so. Like, if I compared him to another high school athlete that I have right now that's about the same age who plays a different sport, plays basketball, but if you had from a strength conditioning standpoint, I think this guy would look more textbook technique in the weight room compared
like better
to the
movement
other guy.
competency, I guess what we're saying. Yeah. Okay.
Only main difference, like even on a low level, something like a quadruped rock back or a you know, a bear position, that right shoulder is here
lives there
whenever.
Yeah, and that's kind of what I'm saying. Like that thing sticks out amongst all the other stuff. Yeah. Okay. Yeah. Cool. Any other ideas or thoughts on that? Yeah. And again, I mean, we've talked about his case a lot. I think one of the big questions that all of us ask, and I don't think you ever know, is like, why do joint restrictions occur? When do you decide to work on that succinctly versus just motor control stuff? And I think with him, you know, there was nerve and like motor control and joint restriction, but it's like, you have to still be extremely systematic. Cause again, somebody could have a pattern that you see and you're like, well, the pattern I would assume existed for him. He's been swimming a lot. Like he swam multiple years. It's like, why now?
Yeah.
Right. Or what changed? And it's, you know, it could be a culminating effect to get that, or with this athlete that I was talking about, a lot all at once and been doing the same thing forever. But then that's why you have to be systematic. Cause like you said, you don't know, you just see him today. You don't know how he swam before, if he's changed it since. So then like, that's why we're almost like playing the simple game of, we see this complex, like your shoulder does this. We can assume that gets thrown into this big, like activity, like swimming, that you're going to do 1,000 strokes. And then you're just doing it over time. It gets worse with fatigue. And they're like, we get all that. Let's do our job and like, you know, get a CT junction moving, calm down soft tissue stuff, work on the motor control, and then see how well that bleeds into sport. And then my athlete, I thought, I was like, I think I could do that till the cows come home. You will have to work the, you know, coaching aspect. What are your thoughts on him? Do you think you have to go to how he's swimming eventually to overcome that? Or do you like, I think I could work on his shoulder, like stabilizing strategy, and like, I think he'd be good.
I feel like there's so much room for improvement with that with the shoulder stability,
Mhm.
that is, that if we cleared all of that up, I would imagine his swimming is going to be
Do pretty
way
good.
better. Yeah, because now if we had tested him all the way up to, I don't know, like a push up or a plyometric push or something that's way
Mhm.
higher level than just a non-weight bearing or a quadruped, like in a quadruped rock where he's not even knees off
Yeah,
the
just
ground.
low level.
Yeah. He's failing that versus
Mhm.
if he was
Yeah.
a lot farther along there.
Yeah. And again, nobody has the right answer.
Yeah.
I mean, I don't think.
Because I would imagine also, because you think about, or you mentioned, we don't know if he started swimming differently, what it was. April, I think, was the end of his season. So he was also probably peaking for competition. So it's kind of like when we see kids in here towards the end of cross country season, or even towards the end of a training block for a road race. It's always close to the taper week that something starts to pop up on somebody, and they've probably done the thing for months, but it's just they had cumulative increased work volume on the same pattern.
And that cumulative and like swimming, like I just think, asking people, or it's curious, like you think of like biomechanics and you're like, oh, maybe the way he swims does stiffen up his neck getting stiffer, especially through CT junction, doesn't allow him to rotate his neck. So now he has to rotate more. So like drags out, like
breathing.
All these things, you're like, supposing you have no clue, but you're like, oh, I can see why like this would get worse if your shoulder operates like this. So then it brings you back to, we're just going to really, even long-term, like make sure your shoulder operates really well so you don't go backwards and then start affecting the swim stroke.
It's just interesting that he also started having pain running.
Yeah.
That's like super. That's the other one that just doesn't, to me, that doesn't add up to like, it's his running or it's his swimming skill to me.
I think once it got
irritated.
I think once it was irritated, because what I found is like I could palpate down long thoracic nerve. And again, if from a breathing, I guess the first time I heard running, I was like, oh, it's got to be something with breathing, right? From irritation, not like how he's breathing, but like it's irritating it. So if you look at long thoracic nerve entrapment, like anterior middle scalene, right? And then obviously it's still pec could be like, I was like, yeah, that's what I think that is. And that's what I asked him. Do you get like, ice pick in your trap or anything? He's like, no, not really. I'm like, oh, okay.
And that was a big key part of it, and which is why I was glad you were able to come in and look at it, because the visit prior, we had talked about his CT junction, and I went in, I think Trent was with me, and I went in and I've MDT'd it every which way, except for extension and lateral flexion. I had done just a lateral flexion, done extension, done flexion repeatedly, and looked for, has that changed? Pain and functional audits. Didn't really see much of a change. Now, granted, also whenever we were in there and you mobilized in that way, it wasn't like that's a lot different afterwards from what I remember. Maybe the sensitivity over the long thoracic nerve was not as much, or the toner on the lat.
I don't know. You did it. I didn't work with him.
That's true.
Yeah, I just palpated. I wanted to. It was like palpating was like hitting this table. I was like, I'm just gonna blow that up.
Salivating.
Yeah. But it's just, it goes back. I wanted to say that for the clinician students listening, like palpation is still your biggest. I mean, I'm reading Clayton Skaggs' new book, and he talks about other medical professions still saying that like manual dexterity and like a hands-on approach to medical care, even from like a primary care physician, is like kind of a lost art that's going to probably become more important as we see the healthcare system get turned upside down, like a housing bubble and AI come about. So it just like makes us all double down on like, what do you feel? Because you could look at mechanics, looking is big, right? Seeing and observing. You could listen to their history. That's important. But at the end of the day, you still got to see with your hands and like tell like, oh yeah, like that is what's, because again, you watch them do this. That doesn't mean that a CT junction is restricted, right? Like a bunch of people could do that and they don't have that because that's not the way that they compensate for it.
This episode of the Farmcast is brought to you by RockTape. Use code FARM20 for 20% off their core courses at rocktape.com. It includes everything from kinesiology taping to vibration and mobility training. We use RockTape here in the clinic. We use all their tools. We've done all the training. It's all worth its weight in gold. So again, use FARM20 at rocktape.com for 20% off.
Right. That's the key, is like mechanics don't lead to a compensation specific thing. It's just like, I don't know, how do you handle it? So that's hands-on. Cool. We got one more.
Let's try and get after it. So I've got I think she's 16, 17-year-old female volleyball player. I had seen her for a long time. I'd say I've seen her for over a year, just with like off and on different stuff. This time she came in, she has low back pain that has started to like increase since she's been doing like club volleyball and also starting school ball at the same time. She plays front row, so she's hitting a lot. And she got to the point where like her mom actually called up here and was like, hey, she acts like she's a pretty tough kid, but like she's coming home crying like kind of like every night right now with like the way her back feels whenever she gets done hitting. And then like, I see her in clinic and I'm like, so how's everything? She's like, yeah, everything's doing great. And so just kind of like navigating that anyways. But yeah, so she, just knowing her, a lot of extension based patterns reproduce her pain. Her mom also went and kind of got an MRI just because she had been like dealing with all that. But like, here's the other part is like, she hadn't told me that her back had been hurting for like a few visits. She had just been like, yeah, my shoulder's been a little banged up.
Oh, so her shoulder you already
it's her hitting shoulder. So her right shoulder has been having issues
prior to her back.
Okay. And so like that's what we've been working on because she'd also she's playing 2 different seasons. She's traveling a lot. Anyways, so her mom goes and gets an MRI. MRI comes back clean. They're like, yeah, there's no fractures or nothing like that going on inside there. And which kind of gives me the green light that like, hey, we don't have any like spondies or anything like that in her back. So because it kind of presents that way, like when you see everything where like opposite side storks and all those different things are producing right low back pain, extension based patterns reproduce it. She's doing a sport that is highly like conducive to like that injury. Kind of begs the question of like, okay, well if her back's hurting, like why, like what else could be the issue? And so we've been looking at her right shoulder a little bit. Well, every time she came in, she also doesn't like her neck being like touched. So like palpating like her neck is tough to do, but she always has like left upper trap tightness. All right. So she's a right-handed hitter, left upper trap tightness. And like that whole left shoulder girl just feels like there's a ton of trigger points in there. But she has right-sided low back pain with everything that she does. So I had been working a ton of like central stability. Cause you can work on that to the cows came home for her. Cause she can't hardly create intra-abdominal pressure at all. Like she has to give, like she either, is like a pretty flat back or she has to like be able to like create some pressure inside her abdomen. She cannot do both. She can't even hardly breathe at the same time that she's like trying to hold this dead bug position. And I'm like, there's so much we could do here. But like, it wasn't fixing our issue. Like it wasn't even touching it because she'd leave and be like, some days she'd leave and be like, yeah, I feel the exact same, which kind of like sucks. But I've done a ton around your core and like we have not changed this trigger point hardly at all in your low back. So then I just kind of was like, well, I just kind of want to test some stuff. So multi-segmental rotation to the right is obviously painful. And she kind of dives into her low back a little bit. And so I just brought her arms up because I know it's a little bit different, but I just brought her arms up to kind of get in the position that she would do for like volleyball, where you have to stabilize with that left arm to come over the top to hit. And she does that. And she's like, yeah, that really starts to like aggravate my pain. So I was like, okay, well, let's look at this left shoulder. So quadruped rock, left scapula, wings a decent amount. And then I think I have her go into like a little bear position, just loaded that left shoulder. Her back starts to hurt again, which again doesn't add up because there's no extension moment there except maybe like her pelvis dumps a little bit. So I don't say I cut ties with just working on just like sagittal plane stability, but I'm like, I gotta attack this left shoulder. Because volleyball is one of those sports that you produce a lot of force, not on the ground. It's one of the only sports that I feel like, because you jump and that's your ground force. But once you leave the air or once you leave the ground, like to me, your legs are kind of taken out for a second. So she's got to pull a ton with that left shoulder for stability. So I go into just a 3-month kind of prone position because I just want to use that as some spinal uprighting and getting her shoulder in overhead position with her right shoulder being overhead and her left shoulder also having like stability play. I have her hold that for probably like 30 seconds. I go back, trigger points like completely gone in her back and have her do rotation. She's like, yeah, it doesn't hurt anymore. Yeah, just bilateral here. So then we worked a little bit of, because I know Trent had been in on a few visits, but there's one where I had her do like a 5-month sideline position where like I'm pushing on her hip to kind of just like stabilize that left hip because she's going to rotate around it, but I want her to work on upper body a little bit more. So I have her come up on her, left shoulder, like I would in a 5-month sideline, but I pin her hip and I have her go through just right rotation with stabilizing the left side, not letting her body roll, which I know is not like super DNS-y, but I am like, she does good on her lower body. I need her to work upper body. So go back to, just doing a ton of just left side or right side of rotation to work on this, where she's like winding up to go hit. Cause this is like getting down to like, I think some skill involvement is where her issue is, not necessarily always she has a pathology, because MRIs rule out pathology. She doesn't have anything with like anything there. So have her do that. And she comes back, and ever since, I've seen her probably like 3 or 4 visits since then. And we've just been working a lot of left shoulder stability, getting her up into basically a side plank, low oblique sit for some people who know some DNS positions. But that trigger point in her back is like almost like non-existent. She's come back. She's like, yeah, I feel really good. And even on days that she doesn't play, because she'll travel sometimes, like her brother and stuff. But yeah, she's like, yeah, my back doesn't hurt. And on days she doesn't play, her back feels better. So there's still a big like left shoulder stability, even though she had right shoulder pain to begin with. But her right shoulder always felt pretty good. Like for it to be an overhead, like for an overhead, like hitting all the time, like I didn't really find hardly anything in her right shoulder. It was always the left side and her right low back.
Yeah.
So what were you working on when you were working on her shoulder before you went to the left shoulder?
I was working on her right shoulder for...
You were doing central stability? In sagittal plane?
Okay. There's 2 things I think are kind of key to point out is, we talk about, you can do palpation, you can do like DNS tests, you can do orthopedic tests, but like, I don't know what you guys or your thoughts or agree or disagree is like, I'd say 99% of the time, the thing that gives me the 2 things that give me the most in on a case are the history and then like the sport specific or activity specific, which is also like McKinsey talks about that a lot, like all that stuff, right? Like it's kind of when you're doing this stuff, it's like how you pitch. It's, when you lift your arm up. And then in this case, that what you're going to say sport task specific, kind of test, then it just kind of makes me think about like the old school research they talk about. And like, even when they were talking about transverse abdominis activation, then it bled into like DNS with like intra-abdominal pressure is like when you go to lift your arm, your core has to activate first. If you do it in reverse, like it's kind of a nightmare, right? So just like lifting something out in front of me like this, if I don't have some activation here, it's like arming the ball in softball. Like you will create compression rather than decompress, or at least neutralize spinal compressive forces to rotate, extend, flex, or whatever. And that's kind of the key is you need pre-activation, which is we falsely do that, right? We'll be like, hey, we're going to have you breathe. We're going to have you create pressure. We're going to put you in a good position. Then we'll have you move around, right? That's what you're doing in a lot of DNS stuff. But then it's like that has to become subconscious if it's, this first, that second. And with her, it obviously wasn't, because you lift and you're like, that's worse. So like she's set to what? I'll just use a bunch of upper, has to put you in an extension position because you have something out in front of your center of gravity. And then what do? You have to compress more. So that's, clever way to get around it. But like I said, I think that's way more my lead in, right? Palpation is like the thing that's like, it's like your compass through all that, but it's like Levitt says, by the time you're done listening to him, you probably should know what's going on. Then you're just like testing to like rule out, or like, are you right or wrong?
Which that's kind of like, because SFMA, is very like, we don't use it necessarily as being like, that's the issue. They need to get better at right side rotation. It's just a look at how they move overall. And I'm like, well, if you move relatively okay, well, let me put you in a position that's like your sport and rotate there. That's my selective functional movement assessment. If I was to say so, like I selected that functional movement and show me how you do it. And it's like, it's even worse. Yep. Perfect. And I added your shoulders into it. And now your back hurts even worse.
And that's why I honestly think those are, outside of like a truly positive orthopedic test that has pain, because again, that can be testing like a tissue or something specifically, or a joint complex. Like those things are much better pain audits to me, because it's us trying to see how you do something and do you have pain doing that thing? Because then that bleeds into, we might be testing like maybe your facet's getting overloaded in a, unilateral stork test, but then also if we have you do it, it's also like, well, the way you do it will overload that facet, not just the stork test. I think that's kind of key for people to realize, because it's not like your stork test is normal and then you might go right back to pitching, and literally that could be, this is my patient. Extension is normal. We have them go pitch like position. And she's like, that still hurts. And you're like, but only thing that makes sense is how you're doing it, not just the structure being loaded. I think that's like really key for people to hear. So it's again, not like, dude, you're good clinically. You're like, see you later. It's like, we have a lot more work to do in terms of helping manage and seeing, force through forest through the trees kind of deal of like, oh, we can't stop here. And that's, like I said, that can be tough in scenarios where you don't have the branch to kind of go out and talk to the position coach or skill coach, or you're like, even at swimming, how do you translate that to their coach of like, hey, I know you're doing this, but like, I don't know, can you work on it? Like, it's very 3 different cases, but then they all kind of lead back almost to the same place of like, hey, how you're doing the thing probably got you in here. But then it was like specifically how you're doing it, like a stability strategy thing. And then maybe a long-term, just like overall life strategy thing of like how you're using that. And then it's like, well, where you work on those things? Like, okay, all ended up in different places. Yeah. All right. Any feedback on any of that stuff? What are you seeing out there?
I just see a light flashing in the woods up there. Light flashing in the woods up there. On that sign.
Go towards it.
It's cool. Yeah.
The yellow one.
No, I can't see that far there. Who knows?
There's a guy out there.
Yeah, we hope. Okay, so we want to give away more rock tape stuff. So what's the competition going to be? We need now, we need a picture or we need a video of you and your clinical setup, your student setup, wherever it is, using something where a rock tape product would be better. So maybe you don't have rock blades, you're using a butter knife because that's just how you roll and you want to be, redneck OG.
It's like everything but a water bottle.
Huh?
It's like everything but a water bottle, right?
I don't even know what you're talking about.
You know what I'm talking about?
Where you drink things
You
like
drink things out of like
water.
Instead of a coffee mug, you drink it out of a
Detergent.
like a watering
Detergent bottle.
pot, or you
Is
drink
this
it out
a
of a
thing?
shampoo
Yeah.
bottle. Yeah,
I'd have to check it out.
it's all
But
the
yeah,
rage. The kids
that.
are doing it.
If you're using, instead of cupping, you're using like a sucker fish out of your aquarium. Instead of tape, it's duct
Exactly.
tape. Like I want to see a picture or video where you're, rednecking it, making it work, but you'd have a product based on the product that you use. So if you're scraping and we decide to use it, we'll send you some rock blades. If it's a sucker fish, we'll send you some rock pods. But that's what I want to see for this. You have 2 weeks again. So this is episode 48. So when 49 comes out, we'll choose. And I don't know what we're giving away because it's going to be based on the input on that one.
Or are they just going to DM a picture?
DM the farm. So at Cara Farm on Instagram. That's how I want you to send that stuff. We'll repost it. We may make a little carousel of those for a special one. But they have to be in by when's the next show?
2 weeks.
Yeah, but Wednesday the
That's what the
Wait,
9th.
Wednesday
That's the
the
8th. I
9th?
think the 8th.
Wednesday the 8th. Yep, ideal world by like before noon on the 8th. That'd be awesome. So again, send it in. Anything but a water bottle. Yep, that.
No
But-
white lightning.
Yeah, if you have a fun chemistry story, let us know too. And we'll see you next time.
Thank you for tuning in. Please subscribe via YouTube, Apple Podcasts, or Spotify. If you like the message, please share it. We appreciate it. Thank you.